Hi, ma'am. I have some questions for you. The government plans to add 10,000 new UG and PG medical seats in the coming year. How will this initiative help address the shortage of doctors in India? Your take on it.
Yeah, okay. So I think it's a very good initiative because in India the basic problem is because we have a large population. So the healthcare facilities are actually they are clumped together in tier 2 and tier 3 cities, but in the deepest villages where 70% of the people of India live and 70% of Indian people they actually need health services, there we don't have the best of medical services. So now because more of PG seats are being used, it means there will be a lot of doctors which will be available to cater to the needs of even the poorest of the person, and every nook and country of the every part of the country will be covered by these doctors. The only thing that I'm worried about is that if we are producing doctors at such a high speed, will we be able to provide the high quality of education that they need, and will these doctors they actually come up with good quality health care which will be imparted to the patients, that to the end user. So that is my most important concern right now. But of course, if we can standardize the education policy and ensure that the doctors that are coming out of any of these government institutes or any of the private institutes, they have a minimum standard of education, and maybe there is some exit exam or some repeat exams which are being done every few months, which can ensure the quality of healthcare that these doctors will provide. So I think that will serve the purpose. So there should be a lot of educational initiatives to keep them abreast about this, and maybe my one suggestion would be that if these doctors are being trained in a particular part of the country, and we can address the maximum disease which is impacting that area, and we educate them more to tackle those problems. Like, just to give you an example, in Assam, there are a lot number of cancer patients, maximum number of cancer patients, but the healthcare services are very much limited there. So if we can focus on the health specific requirements of the country and train these doctors, then it would serve the purpose more, rather than just educating more and more of doctors and bringing them on the streets without providing any value. And we have to generate those job opportunities also for these doctors. So that is, I think, very, very important.
All right. Fair enough. Good points. Also, another question. How does inefficiency in procurement affect the overall cost of healthcare delivery in India? Your take on that?
Okay. So actually, if you ask me, procurement costs about 30 to 40% of the hospital cost while you run a hospital. And if there is inefficient procurement, then it can lead to a lot of challenges. Because hospital is actually which is dealing with the lives of people, where the time is the essence, where the quality is very important. So the good quality drugs, and also the cost is also very, very important. So inefficiency can be in many levels. It can be at the level of procurement, delay in procurements. It could be the product is available in the hospital, but it is not reaching to the patient at the right time. Say a patient lands up in emergency and we are not getting the life-saving drugs. So inefficiency can be in not having the proper drugs which are needed, in having low quality products, in having those products but they are not reaching the patient on time, or the quality of the drugs might be substandard. So this is one inequality. Second thing, that the cost of the drugs might be prohibitive, because there are multiple players for the same product in the market. So if you are having very high cost products but they are not giving any value to the customer, or the patient is not able to afford them, then that also leads to a lot of problems and we won't be able to save their lives. Number three is that because of multiple users, multiple stakeholders involved in this, and because of multiple products which are available in the hospital, the doctor might not feel comfortable using a particular product, and they might have different preferences for particular brands, and the company may not have, the hospital may not have those products. So, and fourth problem is that there could be some budget constraints from the hospital side. So there would be the hospital management might like to give the good quality care and also at the same time contain the cost. So there could be some, we have to have a very cohesive environment in the hospital where there is a good clinical engagement with all the stakeholders, say from who is the requester of a particular drug, who is the approver of a particular product, the provider, that is the vendors and the suppliers, then the consumers, the people who make the budget. So there has to be a good quality coordination and transparency and good communication lines between these groups. And at the same time, we should not forget that the end goal is to bring value to the patient, to the hospital, and to the clinicians. So if we take every stakeholder in mind and design procurement plans and ensure that the inventory is not going waste, it's not getting expired, it's not getting obsolete. Yeah. So all these points have to be considered when we design any inventory for any particular hospital and whenever we procure any drugs, supplies, equipments or any other thing.